Thank you, Mr. Speaker. I'm here tonight to urge my colleagues to vote against the Republican substitute and for the bill reported by 3 committees. After long, I want to tell the House, all members, how proud I am of the discussion that has taken place today. And I want to commend the 3 committees and their chairman, including my good friend, the chairman of our committee, Mr. Waxman, for the work they've done. And you, Madam Speaker, and the leadership, we thank you for the extraordinary leadership which you have given us in bringing us to the point where we are tonight. Thank you. I won't begin by spending much time on the bill offered by my Republican colleagues. It is really no substitute for H.R. 3962. According to the New York Times, and I think this sufficiently disposes of the matter, the Republican amendment does almost nothing to reduce the scandalously high number of Americans who have no insurance, and it makes only a token stab at slowing the relentlessly rising costs of medical care. Interestingly enough, under the Republican amendment, individuals would pay up to $2,821 more, and families would pay $8,188 more under the Republican plan when compared with H.R. 3962. It's not in the public interest that we should do that. Having said that, this is historic legislation. It addresses 2 of the most terrifying problems we have in this country. The first is what was the problem when my dad introduced the first legislation in 1943, that there are now some 47 million Americans without health care. This will give many of them adequate health care and a decent choice of what they will have before them at the best possible price through an exchange which will make it possible for them to choose without having to worry about understanding the language of Philadelphia lawyers and reading fine print that can only be read with a magnifying glass. The bill does something more. It takes care of an economic problem that will be visited on us in 2080. When the cost of health care will equal the gross domestic product of the United States. That will bring us to a fine economic mess if we permit that to happen. Health care and GDP costs will be equal. Now the bill carries out the President's suggestions, deficit neutral. It provides coverage for 96% of Americans. It offers everyone, regardless of income, age, health status, the peace of mind that comes from knowing that they will have real access to affordable health insurance when they need it. It does away with pre-existing conditions, which the bill offered by my friends in the minority does not. And it sees to it that when you go to bed at night, you're going to wake up knowing in the morning that you're going to have health insurance. It can't have been dropped by your employer. And it can't have been canceled by your insurance. There's a practice on which we just had hearings that's engaged in by the insurance companies called rescission. They can cancel your insurance policy by the simple device of rescinding your policy because they say you had some pre-existing conditions. And they can do it while you're on the gurney being rolled into the operating amphitheater. The bill is going to give choice and honest competition. It's going to bring security to our seniors, and it's going to reduce out-of-control health care costs that are crushing American business. It costs $4 an hour less to make a car in Canada than it does in Michigan. Why? Because the Canadians have a program of national health insurance which assures that the manufacturer can compete and outcompete Americans because he doesn't carry that economic burden. Today is maybe a tough vote, but it was in 1935 when we passed Social Security. I hear my colleagues tell us that the economy, jobs, and the financial system overhaul are desperately needed. True, but that was the case in 35 when we passed the Social Security Act. Now I hear my Republican colleagues tell us this is going to stand between, or permit a government bureaucrat to stand between the insured and the doctor and each other. In point of fact, it's going to stand between it's going to permit the government to stand between the insurance bureaucrat and the insured. And it's going to stand between him and the doctor so that the doctor can provide the care he wants.
The gentleman's time has expired.
I ask unanimous consent to revise and extend my remarks.